All right, welcome back to ABA exam review and our continuation of our RBT practice exam series, where we're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Be sure to check out btexamreview.com for all of our study materials, including our combo pack. As always, when you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Which of the following scenarios represents a multiple relationship? All right, starting with an ethics question. Remember, as RBTs or BCBAs or any sort of ABA practitioner, we always need to continue to engage strictly in a professional manner with our clients. So when we talk about multiple relationships, what are we referencing? Well, some of you might call them dual relationships. It's the same thing. It just means there's been a line crossed from a professional relationship where you're delivering services to a personal relationship where you're friends with your clients or stakeholders, or you're babysitting, or you're going to birthday parties, or you're taking big expensive gifts. There's a variety of ways we can engage in multiple relationships. So the question is asking about which scenario represents one of those multiple relationships. A, you work with the client in clinic and at their home. And this is not a multiple relationship. This is professional. It's not uncommon to work with the client in different settings. B, you babysit for your client's brother on Saturday nights. This will be crossing the line into a multiple relationship. Not only are you the behavior technician for the client, but now you're the family's babysitter. We can't have conflicts like that involved when you're the acting technician on the case. C, parents attend and observe parts of your session with your client. That's totally fine. It's actually encouraged. The more parent participation, the better. And then D, you take your client out to eat at a restaurant as part of a planned outing according to the treatment plan. That's just a community-based intervention. As long as it's according to the treatment plan and it's part of the intervention and it's planned, that's totally okay. The multiple relationship, though, would be you're now crossing the line from being a technician to the family babysitter. That's no longer professional only. You've now got a different relationship. You've got a multiple or a dual relationship. The doctor meets with a patient and prescribes medication. The doctor says, take 2 of these and call me in the morning to let me know how you feel. The doctor is using what type of data collection? So in ABA, we have many different types of data collection. The kind of broad ideas of data collection are continuous, discontinuous, and permanent product. And then we also have direct and indirect measurements. So in this case, we have a doctor who's meeting with a patient and he prescribes them medication. The doctor says, I want you to take 2 of these and then let me know how you feel. So if the doctor is asking the patient to tell them how they feel, and the doctor isn't actually observing them, well, he's indirectly measuring that behavior. And we know indirect measurements can include things like surveys and checklists and interviews. And this is essentially an interview. So if the doctor is asking through an interview and indirect measurement for the patient's basically description or own opinion on how they feel, what type of data collection are they using? A, anecdotal. Yes, this is anecdotal data, right? It's basically a story. It's someone's own personal perspective on what's happening. This is an anecdote from the patient on how they feel. Now, why isn't it B, permanent product? Well, with permanent product, you've got to directly observe the result of the behavior. So yes, the doctor could technically use permanent product recording, but the patient would have to come in to see the doctor. The patient just simply telling the doctor how they feel in an indirect measure is not permanent product. Permanent product is still directly measuring the outcome. C, event recording. Well, event recording is basically frequency recording of how often something occurs. No frequency recording is taking place. And then ABC, narrative recording, is looking at antecedents, behaviors, and consequences and writing them out as they happen. Again, not happening. B, C, and D are all direct measurements because we're directly observing the outcomes or the behaviors. The doctor is not directly observing the outcome. He's using an indirect measure, and he's taking an anecdote from the patient, so he's using anecdotal data collection. 3, Mark buys tickets to go see his favorite country artist, then drives all the way to Mississippi to see him. 20 minutes before the show was set to start, it was announced the show was canceled. Mark never buys tickets to see this artist again. What likely led to the change in Mark's behavior? So let's think about this. We're looking at Mark's behavior. And so Mark initially did what? Well, he bought tickets to see his favorite country artist. He drove to Mississippi. 20 minutes before the show was set to start, the show was canceled. So as a result, Mark never bought tickets to see the artist again. Now, if Mark's behavior decreased, what occurred? Well, punishment. Remember, reinforcement increases, punishment decreases. And since his behavior decreased, his behavior was punished. So now we have to ask ourselves, the consequence of him buying these tickets and going to the show was that the show was canceled. And so was something added or taken away? Well, something was taken away, right? The show was removed. The opportunity to see the show was removed. He no longer got to see the show. So his ability to watch his country artist perform was removed. That was no longer a possibility. It was removed from him, meaning it's negative. When we remove something, it's negative. When we add something, it's positive. So Mark's behavior decreased. It was punished because something was removed from him, the opportunity to see this country artist. And so it was negative. So what likely led to the change in Mark's behavior? Negative punishment. If you're just starting to study and you're going through punishment reinforcement questions, this is how you need to break it down. Ask yourself, was something added? Was something taken away? Then ask yourself, did the behavior increase or did the behavior decrease? And as you get better, it's going to go quicker. But remember, when you're first starting to study, you should go as slow as possible because your only job is to get every question right. Going through them quickly is not going to help you. Take your time on each question, go through them, and use them as a learning tool, especially on these fundamentals, the punishment questions, these reinforcement questions. 4, you are asked to assist in developing a skill acquisition plan for one of your clients. What is the first step in developing this plan? We have a skill acquisition plan. This is when we're going to teach the client a skill. And if we're looking for the first step, what are we doing initially for anything else? Okay, because with the skill acquisition plan, we're going to have goals, we're going to have measurements, we're going to have to analyze the data, all these things. But before we can do any of those things, what must we do first? A, identify a target behavior. Yes, before you can set a goal, before you can pick a measurement, before you can evaluate data, you've got to have a target behavior. Without a target behavior, well, we're not really identifying anything, right? We can't pick a goal if we don't have a target behavior in mind. What are you measuring if you don't have a behavior? And then what data are you going to take if there's no behavior to take data on? So the first things first in a skill acquisition plan is identifying a target behavior. Once you have the target behavior, we can set goals. We can pick how we're going to measure those goals. We can start taking data, and then we can go ahead and analyze or evaluate that data. 5, Ms. Nini places 4 different candy bars on the table. The candy bars are rewards for finishing worksheets. Whenever the first child is done with their worksheet, they pick a candy bar. When a candy bar is selected, Ms. Nini puts a new candy bar in its place. What type of preference assessment is this? So we're looking for the type of preference assessment Ms. Nini is running. Now be careful here, okay? We've got Ms. Nini putting 4 different candy bars on the table. So remember, the first thing we ask ourselves with preference assessments is how many stimuli are we assessing at once? If it's 1 stimuli, it's going to be a single choice. If we're only doing 2 stimuli at once, it's going to be forced choice. If it's 3 or more, well, it's typically going to be multiple stimulus. So if we're doing 4 different candy bars at a time, we're likely looking at a multiple stimulus with or without replacement. Now, what happens is whenever the first child is done with the worksheet, they pick a candy bar. And then in multiple stimulus, this is the important part, because once that item is chosen, if we're using a without replacement, then we're just taking that item that was chosen away. If we're using with replacement, then that item is put back and the other items are replaced. However, in this case, the candy bar is selected and then Ms. Nini puts a new candy bar in its place. So this is actually neither, right? Because again, multiple stimulus Without replacement, the chosen item is just removed from the array. Multiple stimulus with replacement, the chosen item is put back and the other items are replaced. In this case, the new candy bar, or the candy bar that was chosen, was taken away and replaced. So it's actually neither, making this a very difficult question. Make sure you understand multiple stimulus with and without replacement. I don't think it's very intuitive at first. So think through it. What is the difference, right? What is the difference between with and without replacement? And why is this not either one of those? 6, which of the following is true about using prompts during shaping procedures? So question is essentially asking, can you use prompts during shaping procedures? And if you can, what is true about it? So what is a shaping procedure? Well, we are reinforcing successive approximations of behavior. And as we get closer and closer to the terminal behavior, we start reinforcing. So first things first, can you use prompts during shaping? Absolutely, right? Prompts are very useful during shaping because we're still trying to evoke those closer and closer approximations. So we want to know what is true about using prompts during shaping. A, prompts should not be used during shaping. We've already established you can use prompts during shaping. B, you can only use most to least prompting during shaping. Again, not true, right? Because you can use any type of prompting during shaping. C, prompting is fine to use during shaping as long as you fade the prompts. Yes, so prompting is fine during shaping, but you have to fade the prompt. So you're going through the same standard prompting procedures you would use at any other time. Just because you're shaping doesn't change that fact. But it's very important that you're fading the prompts for shaping because remember, we need these behaviors to happen without prompts. And then D, you should only use response prompts during shaping. Well, that's not necessarily true, right? Because again, we can use any type of prompts, right? We can use most to least, least to most, stimulus prompts, or response prompts. Ted and Barney are hanging out at McLaren's. Ted tells Barney that he wants to go talk to 2 girls sitting next to them at the bar. Barney says to the girls, "Have you met Ted?" And the girls start talking to Ted. What is the antecedent to Barney's behavior? So, what is our first thing we do in behavior questions? We identify whose behavior we're looking at. And in this case, we're looking at Barney's behavior. Because remember, we have Ted, we have girls, we have Barney, we have all kind of people in this scenario. We are looking at Barney's behavior. And so Ted and Barney are hanging out at McLaren's, right? Ted tells Barney that he wants to go to talk to the 2 girls sitting next to them at the bar. Barney says to the girls, "Have you met Ted?" So here is Barney's behavior. What is the antecedent to that? Well, the antecedent is what happens right before, right? It evokes the behavior. And what evoked Barney saying that? Well, Ted told Barney he wanted to talk to the 2 girls. So we've successfully predicted our answer. So A, hanging out at McLaren's. Well, they're hanging out. That's true. But the true antecedent is what happens right before that. And Ted telling Barney about the 2 girls is the true antecedent. B, Ted telling Barney he wants to talk to the 2 girls. Yes, we just established that happens right before, making it the antecedent. C, Barney saying, "Have you met Ted?" That is Barney's behavior, right? So that's not the antecedent. And then D, the girls talking to Ted. Well, that would be the consequence. So the antecedent is what happens right before the behavior. So right before Barney says to the girls, "Have you met Ted?" Ted tells Barney he wants to talk to the 2 girls. And then Matthew gets extremely anxious and goes through significant bouts of reactivity whenever you observed him reading out loud. Sometimes he's unable to read out loud at all. You still would like to get a measurement of this behavior. What would be the best way to do this out of the following options? So let's think about this. What would be the best way to do what? Well, to get a measurement of the behavior. And to identify the measurement of the behavior, we needed to identify the behavior, which is Matthew going through reactivity and then unable to read out loud at all. But you still want to get him, you want to observe him reading out loud. So how can you do this? Reactivity, right, is when somebody's behavior changes in the presence of a new stimulus, typically a person. And in Matthew's case, he gets so anxious, right, whenever you're observing him, he can't read it out loud at all. So how are you supposed to measure reading if you can't observe Matthew in person? A, take duration data on Matthew reading out loud to his class. Well, you can't observe him reading out loud in person, right? Because he's not going to be able to successfully do it. So you're not going to get good data if you try it that way. What about B, record permanent product data on reading out loud? If you just try to come in later, how can you get permanent product data on reading out loud? It can't just happen, right? Because once it's read out loud, it's gone. So what you need to do is you need to contrive the permanent product data using a recording device. In other words, record Matthew reading out loud and use that as your permanent product. And then D, use whole interval data to measure Matthew's reading. Well, D has the same problem as A, is we can't directly observe him because he's going to react to it. He's going to get anxious and he's going to be unable to complete the behavior. We're not going to get good data. So in order to do this, we want to use permanent product. And in order to use permanent product, we're going to have to contrive permanent product using a recording device. 8, again, tricky question. Some, I would say, difficult questions overall in this week's video. So hopefully you did okay. If not, that's okay, because this is practice. You're learning. Review, review, review. That's the key. When you get a question wrong, you must review it. Okay, go back, look up the definitions, understand why you got it wrong. As always, check out btexamreview.com for all of our study materials, including our combo pack. We'll be back next week, so please like and subscribe. Let us know when you pass. Work hard, study hard. See you soon.